This is Emily Hamilton, and this is my 560 check off for my head to toe assessment. So I'm just going to enter the room. I'm going to wash my hands and introduce myself to the patient. Hi Rachel, my name's Emily and I'm an APN student, and I'm going to go ahead and do a full head to toe body assessment on you today if that's okay.
Sounds good.
Okay. So first I'm going to start in front of the client, and I'm just kind of feeling for any lumps or bumps on her scalp, and I don't feel anything. It feels symmetrical. Just kind of palpating for sinuses here. Is there any tenderness there?
Nope.
No? Okay. Percussing, do you have any tenderness when I'm percussing the sinuses?
No.
Okay. And I don't notice any lesions or anything on the face. Nice and symmetrical. Can I go ahead and have you smile for me? Okay. Can you stick out your tongue? Maybe widen it back and forth, one side or the other. Okay. I want you to blow out your cheeks. Now, don't let me push them in. Okay. That feels good. So I was just checking a couple of your cranial reflexes, and they all feel like they're intact. So I'm also now going to start palpating your lymph nodes back here and kind of go up along your neck, underneath your chin here. Is there any tenderness? No, no. And I am not able to palpate any lymph nodes. I'm going down the neck now and into the cervical chain. And still I'm unable to feel any lymph nodes prominent. Any pain or tenderness? No. Okay. So next I am going to go ahead and move on to the eyes. Do you wear corrective glasses or anything?
I do not.
Do you visit an eye doctor regularly?
No.
No? Okay. So it's really important that you do that every year, because they're going to be able to give you a more in-depth vision exam. Okay? So I'm just going to do a couple different tests with my pen light here. The first one, I'm going to stand in front of you and just kind of check for... Okay, I'm just going to have you look straight ahead at me, and I'm just going to cover this eye. I'm just going to look in this. Okay, I'm going to do this eye. Okay, very good. So next I'll have you cover your eye, and I want you to look straight ahead and follow the pen. Okay, go ahead and switch eyes. Very good. And I'll have you cover the other eye again. And I'm just going to check your pupil and make sure it's dilating and reactive. Very good. Now go ahead and do the next one. Alright, so pupils look good. They are equal, accommodative, reactive to light, and equal bilaterally. So next I'm going to have you then cover an eye. And I want you to tell me how many fingers I'm holding up. But look straight ahead. 2, 3, 4. Okay, go ahead and switch. 2, 1, 4. Yeah. Alright, so everything is intact there. That was the accommodation test, and you did do very well with that. So moving on, I'm just going to look in your eyes here. I'm going to pull this down. Conjunctiva is nice and pink. I don't notice any lumps or bumps. No excess drainage or anything from the eyes. Next, I'm just going to kind of take a look at the nose. I'm going to palpate. Feels equal bilaterally. Any pain in the sinuses when I'm doing that? Nope. No, okay. I don't notice any drainage from the nose. Everything looks good. Are you having any trouble with smelling or any issues like that? Okay, I'll have you cover one nostril. Take a deep breath in. Okay, and how about the other side? Okay, very good. Any difference noticed between the two of them? Okay. So next I'm going to have you open your mouth and say, ah. Alright, looks good. I want you to push your tongue up against my cheek. Or, sorry, your tongue there. Push your tongue there. Very good. Any tenderness or swelling in your tongue that you've noticed or anything? Okay. So first, I'm also going to check your vision. Usually we do a faraway test, but we're just going to go ahead and do an up-close test. See if you can read that. I want you to hold this about 14 inches out away from you and go ahead and read.
Your temporary membership card. Peoria Playhouse memberships. Membership information. Purchase date.
Very good. Any trouble with that at all?
No.
No? Okay. So the next test that I'm going to do is for your hearing. I'm going to use a tuning fork, which I have in my hand here, and I'm going to first do a Weber test. I'm going to strike the tuning fork and put it on top of your head, and I want you to tell me which side, right or left, you hear it in clearest, or if it sounds the same in both, okay? It sounds equal? Okay, very good. So the next test we're going to perform is the rind test. It's the same with the tuning fork. I'm going to first place it against the base of your ear and then hold it out away from your ear. And I want you to tell me if it sounds louder up against the base or away from your ear,
Okay.
or if it sounds the same. Okay? Okay. You hear it?
Mm-hmm.
Okay, tell me when it stops.
Now.
Okay, and now. You hear it?
Yep.
Okay, tell me when it stops.
Now.
Yeah, very good. So normal is having that air conduction be longer, which is what yours is. I'm going to check it on this side as well.
Now.
Okay.
Now.
Okay, very good. So same, your air conduction was longer, which is normal. Next test I'm going to do, I'm going to use this ophthalmoscope, and I am going to look into your eyes. So I'm going to use my right hand and look into your right eye. I just want you to look straight ahead.
Okay.
I'm going to kind of come in at an angle and sweep across your eye, okay? Okay, so it was good. I was able to visualize the cone of light and the red reflex. So that looks good in that right eye. We're going to switch. I'm going to use my left hand to look into her left eye. Okay, everything looks good again. Was able to do the red disc, and everything looks good in her eyes. So next we're going to switch to the otoscope, and I'm going to look into her ears. And I'm going to first start with the left side. I'm going to pull the pinna up, back and down. And I'm just going to take a look here. Okay, everything looks good there. Don't notice any redness, drainage, or anything from there. And next I'm going to take a look, same thing in the right ear. Pull the pinna up, back and down. Look. Alright, everything looks great. Have you noticed any hearing changes or anything like that?
Nope.
Nope. Okay, so next I'm just going to palpate down on your chest for those other lymph nodes here. And I don't feel any. Kind of going to palpate into your underarms. Don't feel any either. That's completely normal. Unless you were sick or something, we would maybe feel something like that, okay? So next I'm going to start moving down your body and take a look at your arms and your hands here. So I notice equal coloring, nice and pink and warm. As I'm pressing on the fingers, her capillary refill is less than 2. I don't notice any clubbing in her fingernails. Everything looks great, symmetrical. I want you to take your hands and kind of do this, okay? Go up and down. Any tenderness or anything when you do that?
Nope.
Nope. So range of motion of wrists is good. I want you to push out against my elbows, okay, and pull in, and that is equal on both sides. So she's very strong there. I want you to shrug your shoulders up, okay, and go ahead and like push against. There you go. Shoulders feel nice and even, bilaterally strong. Any discomfort with that?
Nope.
Okay, I want you to look left. Okay, and look right. Okay. Range of motion of neck is good as well. No pain or tenderness noted. I'm going to go ahead and feel here for her pulses. And they are 2+ strong. And I'm going to move up the arm. See that 1+? Okay, so next I want you to tell me which way I'm pulling your finger, up or down. Go and close your eyes.
Up. Down.
Okay. Up.
Down.
Go ahead and flip your hand over. I'm going to write something in your hand. I want you to tell me what it is, okay?
Okay. B. A.
Okay. I'm going to switch to this side.
F.
Oh, very good. Okay, so that was a good test. She was able to close her eyes and tell me what those two things were. Next, I'm going to put an object in your hand, and I want you to tell me what it is, okay?
Okay. A lighter.
Very good. Okay, and I'm going to put something different in the other hand.
A toothpick.
Okay, very good. And next, I'm going to do a sensation test. Can you differentiate that this is sharp and this is dull? Okay. So what am I hitting with now?
Sharp.
Okay. Sharp. Dull. Sharp. Okay, we're going to try. Sharp. Dull. Dull.
Sharp.
Okay, very good. Okay, so then after we check the arms and the hands, they look great. Next, I am going to go behind you. I'm just observing her back, and I notice that she has a nice equal distance. Go and just breathe normally for me. Any pain or tenderness? Nope. I don't notice any heaves or thrills or anything like that as she's breathing. So next I'm going to palpate for tactile fremitus, and I'm just going to move down your the back and just with my hands on you, and I'm going to have you say 99, okay? Okay.
99, 99, 99.
Okay. Next I'm going to take a listen with my stethoscope. On the back, I'm going to listen to 6 different locations, and then I'm also going to listen on the sides, 5 different locations, okay? I'm going to go underneath your shirt so I can get a better listen, all right? Okay, just take a nice deep breath. Okay, I'm going to go to the other side. Okay, next I'm going to move over to the side of your lung. Nice deep breath. 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 Okay, very good. So breath sounds are clear and equal bilaterally in all 6 locations down the back, and then also 5 locations on the sides. So the next test I'm going to do, I'm going to listen again, and I want you to say E over and over again, and what I'm looking for is just a change in that if it sounds like E or A. Hopefully it just sounds like E and we're good. Okay, go ahead.
E, 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 E.
Okay, very good. So I heard that E clearly in all 6 locations. Next, what I'm going to do is I'm going to place my hand on your back and I'm going to hit it. And what I want you to tell me is if you have any tenderness. What I'm looking for is tenderness in your kidneys, okay? Any tenderness? Okay. Any tenderness? No. Okay, very good. So next, what I'm going to have you do is I'm going to have you lay back here. Comfortable?
Mm-hmm.
Okay. Okay, I'm gonna stand over here. And first, I'm just looking at your chest in the rise and fall. Everything looks clear and equal bilaterally. I don't notice any heaves or anything like that. Feeling here. You feeling short of breath or any trouble breathing at all? Okay. So what I'm gonna have you do is kind of roll onto your left side. Okay. And I'm gonna use my hand here and just kind of feel right here and take some nice deep breaths for me. Okay. And I notice no heaves or anything there. You just stay on this side, and I'm going to take a listen to your heart. I'm going to listen at 5 different points, and I'm going to use both my bell and my diaphragm, so the 2 different parts of my stethoscope, okay?
Okay.
I'm going to go up under your shirt so I don't listen over your clothing, just like that. Perfect. And now I'm going to flip it to the bell of my stethoscope and take a listen again, okay? Okay. Heart sounds great, nice and strong. You can go ahead and roll back onto your back. I'm going to pull your shirt up and take a look at your belly, okay? All right. Breathe normally. So everything looks symmetrical. I don't notice any abnormal bumps or raises or anything there. Skin looks pink. She feels nice and warm. So first, I'm going to auscultate her abdomen. You always want to auscultate the abdomen first, because if we palpate the abdomen first, we start hearing sounds that weren't there until we started moving around, okay? So first, I'm just going to listen in each quadrant for 1 minute, and this is just with the diaphragm of my stethoscope, okay? So you can just breathe normal. Okay, then move down to the other quadrant now. Next quadrant. Okay, so vowel sounds are present and normal active. I'm also now going to listen with the bell of my stethoscope to your arteries, okay? You just go ahead and keep breathing normally. So those are all had a strong, no brewery or thrill noted. So next I'm going to percuss the abdomen, and I'm going to percuss each of the quadrants, and then I'm also going to percuss the liver and percuss the spleen. So here I'm just percussing each quadrant. And I'm going to look actually for the spleen. And next I'm actually going to palpate for the spleen. Take a nice deep breath in. Okay. Go ahead and let it out. I was not able to palpate the spleen, which is normal. I'm going to move on to the other side, and I'm actually going to percuss the spine of the liver and then also palpate for the liver. So starting at the top of her ribcage and working my way down, I'm going to percuss down until I hear dullness. Okay, so I have that spot marked, and now I'm going to percuss up until I hear dullness again. And now I mark that spot here, and I'm just going to measure. And I have 6 centimeters, which is normal. And next, I'm just going to do a palpation of the liver over here. The spleen, sorry. I have those flipped. I'm actually going to do the same thing. Your liver is over here. So this was the spleen over here, which I do not feel, which is normal. And so I'm going to go over here and palpate the length of the liver. Okay, so starting from the top and going down. Okay, have that spot marked. And now I'm going to start from the bottom. and I have that spot marked. I'm gonna take my tape measure here and measure. All right, and that's about 6 centimeters, and that is completely normal there. So next, I'm just gonna go ahead and palpate lightly and then deeply all 4 quadrants. Okay. Any tenderness or anything? No. Okay. Tenderness. Okay. So now I'm gonna do a little bit deeper palpation. Okay. Any tenderness noted there? No. Okay, so these next 2 tests I'm going to perform are the McBurney's and McMurphy's tests, and those are just going to see if we have any pain in either your right upper quadrant. We're looking for appendicitis, and then also colitis, so pain in the gallbladder, okay? So I'm just going to do a really deep palpation here on the right, and you let me know if you have any pain, okay? Okay, so now I'm going to stay on the right side, go down a little bit farther, and do another deep palpation. Any pain there? Okay, so both those tests are negative, which is good. We don't want them to be positive. So I'll have you actually sit back up if I can. Okay, so I am going to go back to the back of her chest here, and I am going to percuss her lungs, since I missed that part earlier. So you can just breathe normally, okay? I'm also going to take a listen to her carotid arteries with the bell of my stethoscope. Everything sounds good there. While I'm back up here, I am also going to palpate the TMJ and make sure there's no pain or tenderness there. Any pain or tenderness? Okay. Any pain or tenderness when you're eating? Nope. Okay. All right. So next we're going to go ahead and move down the body again. You can just sit normally. I'm just assessing color. Everything is nice and warm. Put on your feet here. Cap refill is good. Less than 2. Everything looks good there. So next I'm just going to kind of test your range of motion. Okay, so I'm going to take this stool out. I want you to roll your ankles. Very good. Let's equal strength both ways. Now I want you to push out, push in. Okay, same with the knees. Push out, push in. Okay, can you raise your legs up? Okay, now push down. All right, now I want you to push down like you're pushing on a gas pedal. Okay, and then back towards your face. All right, so everything looks good there. Next I'm going to check your reflexes, okay? I'm just going to use this as my little reflex hammer here. Okay, very good. Very good. I'm going to move down to the ankles here. Right. I'm going to take your shoe off because I'm going to check your Babinski reflex, okay? You just hold. No Babinski noted. That's good on that side. All right, very good. So also, I'm going to go and check the reflexes up on your arms here too, okay? So just let me do that. Okay. And this is just your bicep reflex here. Right. Just let your arm hang there. Okay. All right. So those are both positive, so that's good. Nice equal reaction. Okay, so I'm sorry. I'm actually going to have to lay back down because I'm going to do a couple tests with your leg, and I want you to let me know if there is any pain or anything. We're looking for pain in the right abdomen, okay? So I'm just going to lift this leg up, and just let me hold it. And go ahead. Any pain or anything noticed? Okay. Go ahead and straighten it up here and back.
Nope.
Any pain in the abdomen? Okay. All right. Very good. So I'm going to sit on up here. Okay. So next I'm going to check your knee. I'm going to look at the ACL, and I'm just going to go down here and support your leg. . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . hold your heel here. Alright, that all feels great. Any pain or discomfort?
No.
Okay, I'm going to go and move on to the other side. Let me just support your heel here. Any pain or discomfort there?
No.
No? So I'm going to have you lay back one more time here because I'm going to check a couple other. Just let me hold your leg here. Okay. So I want you to pull up towards you quickly. All right, and go ahead and push on out like you're pushing the door. Okay, very good. I'm going to check the other side. Okay, go ahead and pull up towards you and push out quick. All right, very good. Sit on up here. Any pain or discomfort with any of those tests?
Nope.
Okay, and I didn't notice any moving of the kneecap or anything when I was performing them, so that's all good. Everything checks out pretty well for there, okay? I'm going to feel pulses too while I'm down here. So I'm doing the dorsalis pedis. It's about 2+, okay? I'm going to go back behind your kneecap here. 1+ there. I'm just going to up towards your groin. You have a couple lymph nodes there too. I'm just going to palpate, see if I can feel anything there. Any pain or tenderness? Nope. And there are no distinguishable lymph nodes noticed, which is pretty normal. We don't expect that to be seen, okay? For next, I'm going to have you hop off the table for me. And I just want you to go ahead and walk forward and walk back. I'm just watching your gait, okay? Smooth, steady gait. Very good. So this next test is the Romberg test. I'll have you put your feet together. Okay, and I'm just kind of watching to make sure you don't go anywhere. Your sense of balance is good. All right, all looks very good. So I'll have you hop back on the table. I want you to take the heel of your left foot and run it down the shin of your right side. Very good. Can you go back up? Can you go up with it? Out. Up and down.
Other way?
Yeah. There you go. Yeah. Perfect. All right, that looks great. So you're able to do that. That was no problem for you. Just trying to think if you can do anything else. Okay, so I'll have you hop off the table, and I'll have you go ahead and reach down. You don't have to touch your toes if you can't. I just am looking at the curvature of your spine. It looks nice and straight. Any pain in your back when you do that? Nope. Okay, very good. So you're going to hop up on the table here. I'm just going to think this. Okay. So one thing I will have you do actually is I want you to take your fingertips and go to your thumb. And the next one, quick movements if you can, okay? Very good. Don't look at him. All right. Looks great. And I also want you to take a finger and touch the nose. Take a finger and touch the nose. Touch my hand here.
Do what?
So touch your nose and touch my finger. Touch your nose, touch your finger. Touch your nose, touch your... Now switch hands. Touch your nose, touch my finger, touch your nose. Quick. Very good. All right. So next I'm also going to do that sharp and dull test on your legs, okay? So can you just distinguish that this is sharp and this is dull? Okay. So go ahead and close your eyes. Sharp, dull, sharp, dull, sharp, 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 dull, sorry, dull, dull, sharp. Okay, very good. And I think I am done with my assessment. This is a very healthy 29-year-old female, and everything looks good. Nothing comes to my mind that we would need to follow up with anything. And thank you so much, and I appreciate you letting me perform that on you today.
Thank you.